to diagnose any particular disease, it takes 7 years.
Correct.
So how do you travel with the patient if that 7 years?
Yes. So this girl was diagnosed after almost 19 years. We know that integration of genetic counselling and the genetic counsellor or a genetic practitioner was not there in that family.
Once you diagnose that condition, is there any treatment or any management? Is anything changed after
Correct.
that?
So, many people ask this question is, especially family members, that can you fix the disease or cure the disease? You have CRISPR, can you do this? See, unfortunately, right now, the reality is for most genetic conditions, we can't fix it or cure it, right? We can manage it better. When you can anticipate things better, you can manage it better. In a way, COVID made, DNA and RNA a dinner table conversation. A 17-year-old kid actually sent sample for genetic testing, and their concern is that he lost his mother just a couple of weeks before that. Everybody understood what and how testing of COVID happened. That was a test that we would use, look for the samples of the virus in the sputum sample that we give. But underlying to that, there may be a lot of fear. There may be other concerns that they're dealing with. So I'll give you an example: 2 stage 4 colon cancer, which is a very sudden diagnosis. So the action that he took was actually considering doing genetic testing on his own for a 17-year-old for an adult onset condition, which we usually don't recommend that early.
Thanks, Neeraja, for joining us today and accepting our invite to talk about genetic counselling. And here now we are hearing about genetics everywhere. Like all the cine people are talking about genetic testing and the fitness and everything is there. So what is that technology happened that everybody's talking about genetics? Last 5 years we haven't heard about genetics, but everybody's talking.
Yeah. Well, firstly, thank you so much for having me here. It's an absolute pleasure. And genetics is a growing field, and so of course, we're seeing and hearing more about that right now. The technology itself has become much more cheaper, more available, faster. So right from the initiation of the Human Genome Project to now, the technology of genetic testing and sequencing has become more accessible. We can get larger amounts of data with much lesser prices, and that's what makes it more accessible and cheaper for everyone. And then, of course, is increasing curiosity of how genetics can play a role in everyday life. So we are no longer looking at genomics for rare diseases. We are looking at genomics for public health. We're looking at genomics for prevention. We're looking at genomics for, everyone in daily life. And that's what that shift or the change is making genetics more accessible, and people are wanting to know more about it. How much of that can be applied in your clinic or your day-to-day life is still something that we are looking at. But then the technology is available, people are curious, and that's why 5 and 10 years back, and of course in a way COVID made DNA and RNA a dinner table conversation. Everybody understood what and how testing of COVID happened. That was a test that we would use, look for the samples of the virus in the sputum sample that we give. So it became a dinner table conversation for many people from then. And then it also changed the mindset for many people from, prevention is cure was really something that became a thought process for most of us, especially in India, where the concept of, exercise is not something that most people think of. So it really forced people to start thinking about what else can I do about my health rather than just looking at exercise and diet. Is there something that already predisposes me to diseases? Is there something that makes me more prone to conditions? Is there something in my family history, that would concern me? Or even now, parents and couples are very well educated or curious. It doesn't even have to happen from a socioeconomic background that can access these. Even people in middle class families are now looking at, is there something that I can know before I plan for a child because I want to have a healthy baby? So people are more aware. The medical, faculties are more aware about these things. So there's definitely growing awareness that helps. There's motivation that helps. And then, of course, there is that income, right? So having surplus income helps people to access these things. So while technology is coming down in terms of pricing and accessibility, you also have other factors that's promoting that, growth of genomics and making it more and more accessible for everyday people.
Thanks for pointing out. The accessibility is more here. Like, I get ads in the Instagram and social media, every platform I have the ads for genetic testing. So how is it like ordering a test and getting a genetic report? And where does genetic counselling comes into the picture here?
Correct. So genetic counselling is not just about ordering a test and interpreting that report. It's much beyond that. So genetic counselling is a process wherein we really talk about the risks, benefits, limitations of doing certain genetic testing. It actually begins with a good assessment and interpreting the risk of the genetic disease, whether it's for an individual or for a family, and then talking about what can we do. So being aware about the genetic health of a family or an individual is the first step. And then talking about, okay, now that I understand this information, how am I going to utilize this? Or is there something that I can do about that information? Then we talk about, what are the possible risks that we can identify. Is genetic testing even possible for that condition? There are many conditions wherein genetic testing cannot help right now. So is it exploratory or is it diagnostic? Is it something that will give me answers, or am I just going to look for a needle in a haystack? So weighing that benefit, risks and pros and cons of that process itself, and then also understanding what would I do with that information. Knowing that information is one thing, but can I make any actionable step based on that? Is it really useful for either me or my family member or maybe future kids that I may want to have? And then learning about the reports, but not just that, adjusting to it, psychological adjustment and adaptation is also something that genetic counselors play a role in. And then helping the medical fraternity understand and make sense of that report, helping them understand how we can utilize that information in their, integrating that to their medical health. These are all parts of the genetic counselling. And it doesn't stop with that individual. It's much beyond that. We do talk about their family members. We do talk about their at-risk relatives or their future children. So many times the genetic counselling is a process that goes on for years together because you follow that family through. It doesn't stop with that one particular test or a report.
So as you talk about genetic counselling, how is a day look like as a genetic counsellor for you?
Yeah, that's a good question. So that varies depending on where you are. But I think for most genetic counselors, we spend a lot of our time, especially if you're in a clinical setting or in a diagnostic setting, you spend a lot of time reviewing medical reports, reviewing patients' reports, understanding, what the risk is, understanding the risk assessment. We do spend a lot of time reading about genetic conditions. So if you're patient facing, you would be, involved in pre-test counseling or post-test counseling, talking to family members about those reports. You will be discussing these things with your medical team that you're working with. So it's a collaborative effort. We don't work in isolation. We do work with a lot of clinicians who are involved with us. And we also are, the bridge between the lab and the clinicians and the patients in many cases. So coordinating things between them, helping them understand how, the process flows, or if there is some concerns with the process itself, we do help with that as well. And then, of course, we spend a lot of time documenting things. So that's also something that we do. Content awareness, writing content, talking about it, just what we're doing today. This is a part of, what genetic counselors do. Advocating for their patients, building awareness in the community. So, having group sessions sometimes, speaking to doctors, helping doctors understand what are areas where genetic testing and genetic counseling can be quite beneficial for families. So these are all, day-to-day activities that we do end up spending time. And then, of course, many senior genetic counselors, like I spend a lot of time also teaching and training. So it's also something that we do.
When do you think a person, general public, has to approach a genetic counsellor?
Great question. So I think that if anybody is curious about their genetic health, you should approach a genetic counselor. So it doesn't have to, genetic counseling does not have to end or begin with a genetic test. If you want to know about your genetic health, whether it's about you or your family or probably planning for future children, you should definitely seek genetic counseling. So it sometimes can be as simple as, questions that people ask about, I just want to be able to understand my overall health and want to assess my risk for diseases in the family. Maybe they don't have a hereditary disease in the family, but they want to understand that. And that in itself, is a starting point. Sometimes there is a very strong family history of type 1 and type 2 diabetes in the family, and they're curious about, how can I make sure that I am not at risk of it, or can I delay the process of this? It may not start or end with the genetic testing, but we could definitely address, are there lifestyle factors, are there other factors? many people have cancers in their family, or they may have lost a parent, due to cancer, or they may lost a sibling due to cancer, and that prompts, that I want to now look at what is my risk. And so again, there it may not end up in a genetic test for that person, but we may give you certain, screening to do, or we may tell you that, these are steps that you can take based on your family history. A lot of times we identify the person who's best to test in the family, and we may recommend testing for that person. So there may be a follow-up that's there. So in general, I think for anyone, if you're curious about your genetic health, you want to understand what is your genetic risk, or, how could I live my life better, knowing my genetic information, then you should definitely seek a genetic counselor.
It's very interesting. There are two aspects you're talking here. One is about science and about the patient, the loss and all
Correct.
that. So how a genetic counselor, you think that they will, explain the science as well as understanding their psychosocial aspects?
Correct. So genetic counselors are trained to manage both the science and the counseling part of it, which is the psychosocial skills. So genetic counselors are usually trained in medical genetics and counseling psychology. So they have training to be able to manage adaptation, understand the risk burden, identify when a patient is grieving, or identify support systems that they may require based on what they're going through at that moment. So a lot of times, genetic counseling, a person might come in because they're worried about, like I said, a cancer, or maybe a loss of, a parent or a family member, or a new diagnosis in the family that they've heard of. But underlying to that, there may be a lot of fear. There may be other, concerns that they're dealing with. So I'll give you an example. A 17-year-old kid actually sent sample for genetic testing. And their concern is that he lost his mother just a couple of weeks before that to stage 4 colon cancer, which is a very sudden diagnosis. So the action that he took was actually considering doing genetic testing on his own for a 17-year-old for an adult onset condition, which we usually don't recommend that early. But the fear underlying that was the fact that he lost his mother. So it's actually a psychological coping mechanism, and he used it in this way. But we were at least able to address what he's going through. We talked about, should we or shouldn't we do the genetic testing, and what are the right things to do, how would he want to do this. We eventually paused it for a while, but then, it gave us an opportunity to then talk about what he's going through and what has happened in the last 1 month, which is, of course, a huge loss for him, and a very sudden loss. It was very unanticipated. And so these are where genetic counselors can play a role. So it's much beyond, the genetic testing and the report. We do help in adaptation and understanding how to cope with what's happening in and around their family at that point.
Okay, it's very interesting. Just managing that 17-year-old kid is very... what are the things you were taught in your genetic counseling course, and you have done your genetic counseling in US?
Yes.
So can you please brief on that?
Yeah, so we had a pretty intensive program. So for 2 years, you go through everything, right from medical genetics to biotechnology to interpreting reports to then going through like counseling psychology. So we've had 4 courses in just counseling psychology. We've even done a course through a lawyer who came from a law school to teach us about medical laws. So it was a very good, amalgamation of not just the science, the genetics, the medical side of it, but also very heavy in counseling psychology. And we were also, so I was, for part of my internship, I was at the Helen Keller School at Massachusetts, wherein I worked very closely with the Chart syndrome cohort. So I was working closely with these children so we were sent for volunteering to different places. And it gives us a really good exposure to understand day-to-day life of these kids. So I followed through these children through the entire semester, right from kindergarten to vocational, which is their 21. And it really gave me an insight on how do they manage, their day-to-day life with the deafness, with the blindness, with the progressive disease. A lot of times there's intellectual disability. A lot of times there are surgeries on the way in that process. So how does a parent, the teacher, as well as the student cope with that when you're trying to make them more independent? It gives you a very different aspect. So I strongly suggest that anyone who wants to take up genetic counseling should definitely do some amount of their time, spend some time either during or before, ideally before you go to genetic counseling school, with families or children who may have had rare diseases or disabilities, because it really helps you understand their side of things. And that makes a huge difference. And then with respect to training, so right from our first semester, we were placed for internships. So pediatrics, prenatal oncology was mandated. So 1 semester each of rotation while you have your classes. And along with that, you also have to do some special interest internships. So like I have done research, I've also done mass INER clinic. So these were helpful for me to like look for specific, areas or specialties that was of my interest. So overall, by the time you graduate, you've probably already looked at some 200 odd cases. You've counseled some of those on your own under supervision with some guidance from your supervisor. So it gives you a pretty good experience and varied experiences of how you manage things. And I was lucky to be in Boston, so I was able to see a lot of families from different parts of the world, sometimes with an interpreters. I've seen Mandarin interpreters, I've seen Spanish, Arabic interpreters. And you also see culture, how culture varies from a person to person, which in India, I think all of us who are taking genetic counselling have to be extremely aware about, because whatever state, region, language, everything changes and your family values, your cultures might vary from person to person. So how do you adapt to those during a session? How do you read and understand those in a group of people who are sitting in a room with you? That sensitivity and developing that becomes really important. So that all helped me prepare to then, write my board certification and then be certified with the American Board of Genetic Counselors.
US is a well-developed country, right? The genetic counseling, the understanding of genetics is also very good there.
Yeah.
How about India?
So I think that genetic counselling has existed for a long time here, just that we never labeled it as genetic counselling, right? So we are a very endogamous population. Consanguinity still exists in many parts of the country, and it's a cultural norm, so there's nothing wrong with it. But people are also aware now that yes, because we're marrying in close relations, there's a much higher risk, or that there could be a potential risk. So how do I approach this? There have been many people who have asked these questions for decades, I believe, to doctors, but we just never called it genetic counselling. So we are now at the cusp of recognizing the fact that yes, we need a specialty of people who, are working in this field, because there's growing integration of genetics. And if I compare to, the accessibility of genetic tests worldwide versus India, we are actually very good. Because I have seen patients who, the Indian diaspora who are in the US and the UK, not as much UK, I would say US and Canada especially, even Europe, who have said that they've not been able to access genetic testing for various reasons, whether it's costing, insurance, triaging of patients through their medical system, which is painful. Many of those people have actually approached genetic testing here in India because it's much more accessible. It has its own negative points, because then you also have a lot of misuse, rampant misuse of the genetic testing in wrong places, and misordering of the test itself. But at the same time, because it is so accessible, you have an opportunity there. Right, so it is much cheaper as compared to the genetic testing outside. It is more accessible, but at the same time, how do we put checks in places so that it's done the right way, that people are getting the right information back that they can utilize, and the medical fraternity is able to integrate that into the system. So there's a lot of opportunity now. There is, a lot of growth in that sense, and many doctors are recognizing the need for genetic counselors. I've spoken to some of the, best clinical geneticists, clinicians who ordered genetic testing in India, and they always say that, we need well-trained genetic counselors, because while I can do all of this, I don't have the time.
Yeah, true.
I have to manage my things. So I always see that genetic counseling is collaborative. We are not competing with anyone. We work with the geneticists. Their roles and our roles are very different. We do need them for the diagnosis, but at the same time, the patient benefits when we are able to give them the time for the counseling itself. Right? Similar to that, we need the clinicians for the treatment while we support them. So it's a teamwork, it's collaborative, and that's how it needs to grow going further.
Yeah, and as you pointed out, misordering of the test, right?
Yes.
I just want to ask on that. What happens if we do the misordering of the test?
Correct.
One thing. The second is, all the test gives any result, right? Genetic testing. So can you brief on that?
Yeah, so the purpose of genetic testing is very different, right? So every test has its own purpose. Depends on what are you really looking for before you decide what test needs to be done. So the first step to any risk assessment is a good differential diagnosis, which means you're trying to make a list of diseases that you suspect the most based on what you're seeing clinically. When you have that, you've done that well and you have a strong differential diagnosis, you will most likely order a test that will most likely give you an answer to that disease, or at least you're looking at the right set of genes. When you are ordering the wrong test, you are telling the patient that you got a normal report. There may be a sense of false reassurance wherein you tell them that, okay, we didn't find anything, but maybe you were never looking at the right set of genes. And that is where you run the risk of a misdiagnosis or, completely giving them a wrong diagnosis. The other risk that you have, of course, other than financials, which is, each of these tests costs certain money. So you can't keep pushing the patient to pay again and again over a period of time. The other problem that happens is an uncertain report. Because Indian cohort, the Southeast Asian population is not that well, tested in terms of genetic testing. We don't have a very good reference. Now we are developing that with the Indian Genome Project. We run the risk of having a lot of uncertain variants, and that can cause a lot of anxiety for people, confusion, or a sense that, I did all of this and I didn't get my answer. So frustration there. So that process itself can be grueling for many families, and then there comes a point where either there is another child with a diagnosis or prenatal testing, that decision comes into place. The uncertain variants can create havoc. So in order to reduce those kinds of chances and to get to a diagnosis at the earliest, you want to make sure you're ordering the right test, right? Sometimes it's also technology. Maybe you didn't have the technology, for all that time, that you can't order the right test at that time.
As you pointed here, Dr. Ashwin Dalal sir had pointed out that to diagnose any particular disease, it takes 7 years.
Correct.
So how do you travel with the patient if that 7 years...
Yes, so that's what we call diagnostic odyssey, which is the amount of time that it takes for a family to actually do the genetic testing, go through the process, identify the disease, or understand what happened. So as per literature, the overall time that we have seen is 7 years. That time is reducing given that the speed of genetic testing, the accessibility of the genetic testing, and the cost of it. But I think it's very important that a family is integrated with a genetic counselor. This is where I think we are pretty uniquely positioned, because many times the family in an ideal setting, if you have a multidisciplinary team where there is a geneticist, a clinician, or a nurse, a genetic nurse that's working, and a genetic counselor, when the family comes in for their annual, checkups and their screening, while the physician, the geneticist, everybody is doing their evaluations, the genetic counselor also has an opportunity to go through and see, okay, what changes have been there, review the family history, review the person history, talk about new things that may have come up for the family, advocating for the patient, right? That's our main role. And so that gives us an opportunity to be able to do that. I'll give you an example. So we had seen a 17-year-old, who I think was 19 actually by the time I saw her, who had severe intellectual disability, sleep-related issues, was diagnosed with autism. There was hand flapping movements, dysmorphism present. So she was from a well-to-do family, pretty affluent family, back in 2008. This is, of course, when genetic testing was not that accessible. The families already had a karyotyping done. They already had even a MECP2 gene sequencing done for Rett syndrome. All of that had come back negative. After that, there was a period where the family decided to not, pursue this further, and they kind of fell through the system. There was no genetic counselor back then, only a clinician had seen them. They've given the reports. They did everything they could with whatever was available in that point of time. Now, after that, they continued to, do their screening and therapy and everything. No conversations of genetic testing has happened because nobody was involved in that at that point. And of course, fast forward 2011, 12, whole exome sequencing, clinical exome, everything has come into place. Now in 2024, 25 is when they came back saying that now the sleep related issues have been increasing. We want to, try and see if I can do another re-diagnosis. In the meantime, she's also had seizures that have come up. And so 25 is when I saw her actually, early 25 January is when I saw her. And we felt that this is much beyond what we are, looking at. MECP2 was already done, so that was confirmed. So we decided to go ahead with a larger panel of genes to look for, there could be a single mutation that's identified. And we found a gene that actually replicates the disease like an MECP2.
Oh.
So it was a pathogenic variant, the de novo mutation. We have tested the family members and we confirmed the diagnosis for her. So this girl was diagnosed after almost 19 years.
Okay.
Right? That's her diagnosis.
Not 7 years anymore, I think. It takes.
For this family, it wasn't. And that's because, that integration of genetic counselling and the genetic counsellor or a genetic practitioner was not there in that family. for whatever reason, right? But this is where, we can play a role, is that genetic counselors can help you reduce the diagnostic odyssey. Technology does improve over a period of time. We still have so many patients, even with everything, even with whole genome, you can't figure out what's happening, right? But we know it's genetic. So maybe another 5 years down the lane, if we have something else or a better technology, maybe we can give them a diagnosis. But how do we make sure that we continue to see them? Which is why, earlier I said that genetic counseling doesn't stop or start with a genetic test. It's a process that we continue to do over a period of time that helps us understand how to manage the family. There may be newer concerns. Right now, this family's concern was, how do I make sure that she sleeps? Because there are days that she doesn't sleep. There are days, like 3 or 4 days of no sleeping, which affects the mother, which affects the father, which affects the family. And like, she's not eating, she is, so she's going through all of these, right? So it's just not the patient, it's everyone.
Family, yeah. So, is there any diagnosis? I mean, once you diagnose that condition, is there any treatment or any management? Is anything changed after that?
Correct. So many people ask this question, is, especially family members, that can you fix the disease or cure the disease? You have CRISPR, can you do this? See, unfortunately, right now, the reality is, for most genetic conditions, we can't fix it or cure it, right? We can manage it better. When you can anticipate things better, you can manage it better. When you're able to say that, okay, this may be the risk of, so and so symptoms in the future, you can manage those things better. Even for this girl, we can't cure her symptoms, but we lost that period of, that crucial time of intervention, where we could have helped her develop better. We could have helped her at least be a little more independent. Right? Currently, she's not even toilet trained. And so, for the family, we lost that very crucial period where we could have given her a little bit of more developmental time. And so, it helps you manage the condition better when you know that, okay, here's what we anticipate going forward. So how do you help that family to manage not just their therapies, but also understand what to expect in the future, right? So genetic testing may not often give you a therapy, which of course is happening for some conditions like SMA. It's happening for thalassemia. Now there are newer diseases where they're looking and considering gene therapies. So that is, movement is going on. In oncology space, genetic testing is hugely beneficial because newer therapies are available. You have personalized therapies. BRCA1 and 2, PARP inhibitors, have been amazingly works well for people who have BRCA mutations. So it does give you a lot of, interventions in certain cases, but not in all cases. But then it helps the family understand things better, manage things better, for the medical team also to be able to, have a sense of understanding of what should we screen for, and you're not blinded anymore by that.
There are many, you have spoken so many things, but I wanted to pick up few questions from that. The one is, you said that there is accessibility is there, and awareness is just building up, right? It's not complete awareness. So when there is a family person who is affected, when does a person thinks that they should take a genetic testing? They should not go in wrong hands, no? So how do you, what do you suggest to that people who are scared about the genetic testing, scared about any genetic disease, and how do they approach it?
So I think a lot of it comes from, right now depends on how the families are approached. A lot of times genetic testing comes to us only when the doctor is recommended to do the genetic testing because they suspect a genetic condition. Sometimes it's the family members who think that, yes, there may be something genetic and I want to know more about it, and that's how they approach it. Sometimes it may be because, somebody, they've read somewhere now with, AI and all sorts of, social media being there. There's so many influencers and they say that, okay, I may be affected, I may have this, I may have that. There are so many people that I also see who think that, I may have this condition and I want to come here.
Exactly.
Sometimes it's the doctor that, over a period of time, they've been suspecting something and they want to consider that. So one thing is that, your question about, how should they approach or when should they approach? Like I said earlier, it's about when you think that you're curious about it, ask for it, right? A lot of times the point at which they get referred can vary. It may be because you're pregnant and there was a history. It may be because a child is sick. It may be because of an adult who is being suspected with a condition, or just because there is a family history. But the point is that if you're curious, you want to know, then you please approach the genetic counselor.
If not genetic testing, at least they can
at least come and talk, learn about it, right? You don't have to make a decision about genetic testing just because you come for genetic counseling, right? It's more about knowing your risks, understanding what does it really mean and how would that help. And you make an informed decision only when you think you're ready and you have all the information that you need.
Okay. You said like 19 years they were not under diagnosis and they recently diagnosed, right? So what changes in the family about the disease after they receiving the genetic diagnosis?
Yeah, so it's a good question. You know, a lot of times families cope very differently to receiving a genetic diagnosis, and that point of adaptation is really important. Sometimes there's grief that now you've labeled it genetic. You know there is no cure, or that we may only be able to manage. I think until they receive that, there is a sense of hope that maybe this is not genetic, maybe it's something else, maybe it's, some other things. Maybe there is a cure for it, or maybe you can, improve things. So sometimes there's grief, sometimes there is a sense of relief. So for this family, given the long time that they didn't know what was happening, there was a huge sense of relief that now we have a closure. And that's what Diagnostic Odyssey does. A lot of times, it gives them a lot of closure in terms of knowing what is happening, understanding that, okay, I know that, this is now a genetic condition and we have a label or we have a name that can be given to it. A lot of times, families, parents, mothers especially, have a sense of guilt that's associated with, they think about, did I do something? Did I eat something? Did I take a medication? Maybe I didn't care for my child properly. That could have caused it. Maybe they had a fall, when they were really young. And there's so many attachments to it. And it takes away that burden when you have a final answer to that. A lot of times it also gives them a sense of hope because they think, okay, maybe now I can think about research. Maybe I can think about a clinical trial. Maybe there are new drugs that are, discussions are going on. Like for SMA, it changed so much for many families now. They are trying to seek therapy, medications, the injection from various places. There are Nidhan Kendras that government has set up now where you can register your a member, family member, or your patient, and you can see if they are accessible to that treatment, depending on the age of diagnosis, the type of disease, and how severe that is. So there is a lot of hope in that sense that once I know this information, I can maybe seek therapies. There are also many people who are looking for this outside of the country as well, where they say that I have the accessibility. I can at least try to register myself in a clinical trial, even if it's not within India. So there's various reactions that you get, right? And a lot of times, we say that there are 5 stages of grief, and many times you see family members do go through that process, from the whole knowing that there could be a suspected genetic condition to then accepting it. Sometimes there's denial. They say, no, this is, not something that can be present. So there is a resistance in some people to go through genetic testing because of that. And then they're depending on whether it's, in some cases, it's an X-linked condition. So sometimes there is a sense of guilt in family members that I passed it on, or even autosomal recessive, families where diseases where we've seen consanguineous couples who say maybe we, got married within a closer community, which is why this has happened. But, at the end of the day, we want to remember that, and genetic counselors play an important role in that, is that you can't pass on something on purpose to someone. Neither do you receive something and you know it. It is just natural. And so helping them deal with that sense of guilt, sometimes there is stigma that's associated with everything that's happening in the society. They feel that, they're being blamed for it. And then going through the process of accepting, adapting that information, then being able to use that as a knowledge to, help their family member or their child or themselves. And then also being aware. A lot of times I find that the best advocate for that particular condition is the patient themselves and the family themselves. Nobody is a better advocate than them. They may, I've seen so many families who educate themselves in that disease, who learn everything. Sometimes they know more than I do. A lot of times they do. And I get to learn from them, and they know the most updated research, they know the most updated support system, they know what challenges to face. They become the support system to many other family members. And that's the kind of strength that, they show. All patients are resilient. And I think genetic counselors do help them realize that that's the process that we help them go through.
Yeah, thank you. And when you say genetic diagnosis, genetic testing and all, when you identify a mutation, it's not only for the family, right? This is
Yes.
extended family. How do you think in an Indian scenario convincing the extended family to get that diagnosis done?
Correct. So cascade testing is what we call them, where we want to do genetic testing for extended family relatives. Sometimes it can be challenging, sometimes it can be very easy, depends on the family. There are families who are very close-knit and, they will come with their uncle, aunt, niece, everybody. And they will say, okay, I'm just going to immediately, inform this to everyone. And it's much easier to handle that conversation. Sometimes there's resistance and there may be some family feuds and they don't want to share this information. So genetic counselors do play roles in various ways. Sometimes we write a family letter, we educate why sharing that information is helpful. We give them, brochures or letters that they can share with them if they don't stay close by or don't have very strong connects. But most of the times what we find is that even if there's a bit of resistance, they are at the end of the day agreeable to at least speak to the family member. And we always give them the choice to come back with the family member or be a support system to their family member to talk about this even in their absence if that's what they want. So one is maintaining confidentiality of your own client. That's really important. You cannot, no matter what happens, your duty to warn is to your patient. But I cannot breach that confidentiality and go tell another person. Even if you're seeing, this happens quite a bit of times that the same counselor sees two family members of the same family. But you cannot share your information unless you have permission from your patient to say that I want to share this with, my so-and-so family member.
Sorry to break you. Why, if it is very important, the diagnosis is very important, why do you think it cannot be shared with the family?
So you have certain ethics that you follow in genetic counseling, in medicine also. Confidentiality is one of the most important ethics. Your confidentiality to your client cannot be breached without your client's permission, right? So if your client permits you to share that information with a family member because they find it difficult to share or they're not able to find the words to share it or there is some other resistance, but you have permission from them, then it can be done. But without that, it cannot be done. That is one of the major ethics that we follow in genetic counseling and in medicine also. But yes, your duty is to warn your patient that, listen, this person is at risk and they may benefit from screening or they may benefit from knowing this information. Let them think about it, let them understand the risks and then come back to you with, okay, here are my next steps or can you help me in this way? And we can be available as a support system to help them, bridge that process.
So, genetic counseling is about genetics and counseling and also ethics. And you also said about law when you studied. So, what is this course all about? What is this genetic counseling is about?
So, genetic counseling is a amalgamation of various things. Of course, you have to follow a sense of ethics when you practice counseling. There are certain basic ethics that you definitely have to go through. We do see a lot of ethical, social, legal issues when we see genetic counseling because oftentimes this is, combined with family. You think about like medical insurance, there is discrimination that happens. There's society, so there's culture, religion, faith that interplace all of this. And then you do need to know science and you need to be able to understand. So the reason counseling psychology becomes really important in the process of genetic counseling is because you understand the impact that genetic disease doesn't just impact the family, it also impacts the society and the vice versa, that the society impacts the family, the laws impact the family, the medical community and the availability of both medical insurance and, medical technology and treatment affects the family. And so genetic counselors are pretty well versed in handling all of these scenarios. And that's the reason that counseling psychology plays a very important role in being able to manage all of these at the same time.
If genetic counseling deals with many aspects in this, right? If we remove this genetic counseling from the healthcare system, what will happen?
So one is the misuse of genetic testing. One of the biggest challenges that we face right now is the fact that a lot of times you get reports but you don't understand what it means. There are many doctors who are very well versed with it, but unfortunately sometimes they don't have the time to spend to understand how each of these aspects plays a role. A lot of times there is, genetic diagnosis hasn't happened, right? and many times you miss that diagnosis, and there may be risks for other people or future generations that have just not been identified at all right now. So it does have a lot of impact on many people. And while genetic testing is a part of that counseling, it is not everything, right? So we can play roles in many other areas that may not be something that other professionals would be able to justify in their time and the training that they have.
Okay, and where do you see this genetic counseling field in 5 years or 10 years?
So genetics in general has been, it's getting more and more integrated into medicine, right? So now with the advent of liquid biopsy and being able to do tumor testing, there are personalized therapies in cancer, there's personalized genomics, there's wellness. So like I said earlier, you're not looking at genomics as only for rare diseases anymore, so it's much beyond that. It's for the general public right now. And there are many couples who want to understand their risk before they plan for a child. So there's carrier screening. With the increasing level of infertility, there's more use of IVF. So again, genetics comes into place. So every single field in medicine, genetics is now starting to play a role. There's pharmacogenomics in critical care. There's, newborn screening for children. So every single area we're seeing more and more use of genetics. And so the use of genetic counselors is essentially required more at this point than it was 5 years back, and it will keep growing from here. What is important is that genetic counselors are well trained in their foundation and understand how to adapt their training to various scenarios. So like when I was in grad school, when I was studying, panel testing, whole exome sequencing was not a concept that existed. So we would do, gene by gene, and we would have a very strong differential diagnosis, do that one gene. So if we think it's, connective tissue disorder, we knew it was Marfan, we'll do the testing for Marfan. If we think it was Stickler syndrome, we would do just the Stickler syndrome. Now what happens is you think, okay, we see connective tissue disorders, you give for a large panel or a whole exome or a clinical exome that covers pretty much everything. We had to readapt all our skills to fit into that sense of, so we started thinking about, oh my God, how do we discuss 20,000 genes in one session? Because earlier when we did this gene by gene, we would tell them, this is the gene, this is the disease, here's the symptoms, here's what to expect, this is how the management would look like. But now suddenly you're testing for some, 12 to 20,000 genes. You cannot practically discuss every single gene on that panel. So how do you adapt your genetic counseling skills to fit that? And just as genetics is growing, we are now seeing genetic counselors adapt in various situations. Somatic testing, we talk about personalized genomics and looking at, microbiome, so many other skills. Even in rare diseases, there are so many types of technologies that have now come up. There's MLPA being used, we are using PCR-based testing, we are using Sangers, we are doing, your massive parallel sequencing. Sometimes it's a combination of all of these. Now you have, low pass genomic sequence. So there's so many kinds of things that are coming up that you need to know as a counselor on how do you adapt your skills to then help your patient in that scenario. And that is an essential skill, I think, that upcoming GC should continue to have.
Okay, so then it's not only about learning all this, but updating yourself is also very important. So how do you update yourself?
Yeah, so that's again, I think I always feel that no genetic counselor should stop ever reading. You should keep learning new things because there is new technology. And if you stop reading and you don't update yourself, you're going to lose track of what's happening. So for many genetic counselors, like for example, for myself, I am board certified by the American Board of Genetic Counselors. We have a certain continuing education units that you have to complete every year. Every 5 years, there is a reaccreditation that happens, which either you rewrite your exam all over again or you collect these continuing education units, which accounts to almost 300 hours over the last 5 years. And that's not it. You need to teach, you need to train, you need to do research, you have to publish. All of these have individual points. And you have to submit all of this. It goes through a process of audit, and that's when you get recertified. So it's a pretty grueling process for you to keep going through every single year. But what I realize is that actually helps me keep myself updated. I keep learning. I keep looking out for what's new, what's happening, where can I learn more. And that is a very important part of, what any board or training program is when they're setting up, is to think about how do we update ourselves every single year? What do we do to make sure that we are learning new things?
Can you give us an example of any case which is very close to you or that helped in the diagnosis to the child or the family?
Yeah, so I'll tell you a story about a family where I feel that genetic counseling did have a very deep impact in terms of how they make decisions and what next steps are. So a couple who comes in for genetic counseling just out of curiosity, saying they are a little bit advanced in age and wanted to consider having a family, and they said let's just assess if there's any risk and let's think about carrier screening. And when we do our initials, a family history is your best risk assessment tool. Take the family history, you immediately see that there is a risk of spinocerebellar ataxia, which is a very common disease, degenerative disease in the Indian community. And we immediately identified that that risk was present in the family, and we talked about genetic testing for the affected person first. So that affected person then came in for genetic testing and they agreed for testing, and we found a positive report. Now the male partner said he wants to consider testing. Now this is predictive testing because you're not currently presenting with symptoms. You're fairly younger, but you're at 50% risk. So first is, how does knowing this information help me? If yes, then what can I do with that information? How does it impact my decisions of family, right? Or even considering having future children. So after having a pretty long discussion, I've followed this family over the last 3-4 years actually. And they said, we'll go ahead with the testing. And unfortunately came back positive. So now there was discussions about how does this impact my personal care, my own health care, the fact that I may be at risk of symptoms in the future. There were discussions about how do I inform this to my insurance or not? What about my employer? Would they know about this, and how does that impact my decision of having a career, or should I change my career paths in fact to accommodate for the fact that I may present with symptoms in the next decade? And understand that these are people well into their mid-30s, early 40s, so they're at the peak of their career at that point. So these are things that really impacts anyone's family, finances, all of them. So then we talked about, okay, what about financial protection? Like, how do you make sure that you have enough money to support yourself? And they suddenly found themselves at a point where they said, we came here to think about having a family, and I think we're going to pause that decision right now. And both husband and wife were at different points of discussion where the husband felt that he didn't want to have a child now because that would then mean that he won't be able to support his female partner, and that it may just increase burden on her. And so for almost a year, they kind of paused this whole discussion. And then we were in touch through the whole thing, and they came back again and said, we're considering having IVF and a donor sperm. So then we talked about the risks of having a donor sperm, how does that work? And then they eventually decided they didn't want a donor sperm. They said, we'll take a chance and do an IVF. Now, this is a triplet repeat disease wherein PGTM is not very specific. There is still a certain risk. But they understood all of that and they decided to go ahead with it. So they eventually did have a healthy baby. And this whole process, took almost 3 years. And so genetic counselling here does have a significant impact in first the risk assessment, identifying the risk in the family, the genetic testing, the adaptation to it. There was a sense of, grief in this whole process for a couple of months where, communication, grief, all of these were concerns. So we addressed all of those. How did this impact their own decision, their own personal planning of, having a family? And then coming back to it after a couple of years of discussions of maybe we want to adopt, maybe we want to consider IVF with a donor gamete, then decided to go ahead and have a child. So it really helped them in the process, and in that duration, I actually sent them for second opinions because I said, hear what other people have to say about this. So we sent them to experts also. They took a lot of opinions, talked to their family, thought through this. So I feel that, like I said in the very beginning, is that it's a process. It doesn't stop with one appointment. For many cases, it does. They don't come back. But when you see it, how the impact of that one single decision of I want to know about my genetic health impacted everyone in the family and their own decisions to, how they want to go ahead with their future life.
Thanks for explaining all the case in detail and what the year-long journey with the patient. And how do you think this gap will fill in coming years?
So like I said, I think the accessibility of genetic testing is going to keep growing. The integration of genetics in medicine is going to keep growing because we see more and more of that. In the future, we do anticipate more therapies, personalized therapies coming into place. We anticipate more use of genetics in understanding health of a child, health of an individual. So there will be more and more utilization of genetics in medicine. Now the question is, how do we bring awareness? And second is, how do we train enough people to manage the requirement that we have? So genetic counselors do play an important role in advocating for their families, but at the same time bringing public awareness, also educating your medical fraternity, right? That is another place where we play an important role. Policy making is really important. So a lot of us do talk about how do we work with the government at a very grassroots level to bring genetic counseling and genetic testing at that level, to be able to bring awareness at that level, because you want to reduce the burden of genetic disease in our country. Then we also want to be able to identify how can we train more genetic counselors. We're barely 200 odd people right now. We need more genetic counselors, and we need better trained genetic counselors. So how do you fill that gap? So trying to work with educational institutes where we can, bring in better education, improve the current education, train better genetic counselors. So I do a lot of internships as well. And that gives me an opportunity to train the current set of genetic counselors, improve their skills, help them, have the support system that they need. It's a very tight cohort, which is good. Genetic counselors are generally, people who are very collaborative, very empathetic. So it's great. I mean, I have seen amazing support in the last couple of months through many things that I went through. And I feel that having that peer supervision, peer support is something that definitely helps the community push forward.
Okay, one last question. Who do you think that they should take up this as a career?
Yeah, great questions. I think anyone, first prerequisite that I always seek in most people are genetic counselors are empathetic. They're very empathetic in general. I think a bit OCD also. All of us are to an extent. It's a skill that helps you, just be good at doing the whole, solving the puzzle of the genetic disease itself. But at the same time, I think most of us are people who really are passionate about helping others, listening to others, very empathetic, compassionate people. But at the same time, you love science, you love to read, you want to know more, very curious. I think that's the basic prerequisite that most genetic counselors have. And then beyond that, I think it really depends on what that person wants to do. If you're someone who's passionate about playing a role in somebody's life and maybe being able to help them in some way, you love genetics, you love science, you love medicine, I think it's a great field to be in.
Thank you, Neeraja, for joining us.
Thank you so much. Thanks for having me. It was a pleasure. Thank you.
Thank you.